Thank you for tuning in to the Helium Radio Network. You are listening to a rebroadcast of a previously recorded show.
Hey guys, welcome back to Sessions with Sarah on Helium Radio. Today I'm with Dr. Bishara, and she knows all about your gut health and how it affects you in COVID. Welcome to our show. I'm so excited to have you.
Thank you so much. Thank you for having me.
Of course. Now, you wrote a huge article during COVID where you discovered where gut health may play a factor into people getting COVID. Could you tell us a little bit more about how you discovered that?
Sure. So I live in New York City, and as most people know, New York City got hit like pretty early with the pandemic. Right. So a lot of things were shut down. My office, which is mainly outpatient, and I focus more on gut health and weight loss, that was closed because we weren't really considered essential. But my husband, who's a pulmonologist intensivist, had the opposite effect, where he was actually kind of just like thrown into the ICU coverage like daily. So it was very interesting. And early on, like back in March, of 2020, when we really didn't know much about COVID, I would pick his brain every night about what was going on, what he was seeing in his ICU patients. And we kind of had this conversation one night and the light bulb went off. So he was telling me about his patients because, at early on, everyone was talking about high risk individuals, right? Patients who are elderly, heart disease, diabetes. And he was seeing these patients in the ICU. But then he was seeing these patients who really didn't have any medical problems, were, a little bit more on the younger side, like in their 40s and 50s, but they had a high BMI. So he came home one day and he, knowing that I do weight loss, he said, it's really strange. We're starting to see a lot of patients who are a little bit overweight or BMI over 30. And we're finding that they're having this cytokine storm, like this triggered cytokine storm, and they have really high IL-6 levels. So IL-6, and we could talk a little bit more about that later.
Everybody's probably like, what is that?
I know. So IL-6 is an inflammatory marker. It's basically like an immune responder that our body uses to kind of fight off infections. But he was finding that these specific patients had very high levels. So he started asking me, like, do you know if patients who are overweight have higher levels? And, oddly enough, IL-6 is one of those immune responders. It's an interleukin, which the body kind of releases in response to like supposed inflammation that the body sees, right?
Right.
So it's actually a little bit higher subclinically, even in the same individuals that are getting sick. So they already have this like subclinical inflammation, right? And in short bursts, IL-6 is great because it's that responder. It gets things done. Your body responds. It's an adequate immune response. But unfortunately, when certain people have a chronically elevated levels of IL-6, that's when it's not so good. It's similar to cortisol, where higher levels of cortisol.
Like stress.
Yes, exactly.
Okay.
Exactly. So after he told me that, I kind of just started thinking like a little bit more research into, okay, this makes sense. But then we were also thinking, well, it's odd because kids weren't really getting sick, right? Everyone was saying children aren't really getting sick. And so I wanted to find out what it was about specifically children and why they weren't getting sick. And overall, we know that children's guts are much healthier than adult guts, right?
It's good to be a kid.
It's good to be a kid. Exactly. Your body
don't get bloated.
Exactly. Your body can tolerate a little more insult, right?
Right.
So until a certain degree, right?
Right.
So oddly enough, we kind of started focusing on the gut, and we found that the gut microbiome, which is the trillions of organisms that are actually present in your gut, is very different in children, and more specifically in children under 10 than it is in adults. And more specifically, they have a much higher level of a specific gut microbe called bifidobacterium in their gut than adults do. And it's funny because children have they can have up to, it varies, up to 50 to 80% of their gut as bifidobacterium, whereas in adults it starts to slowly decline.
Right.
So, myself and my husband, and then a couple of colleagues of mine who are scientists and like they're more into the immune pathways, which is the stuff we don't really do clinically. We kind of started putting our heads together and doing a little bit of research on bifidobacterium and if that was maybe something that was related to what was protecting children. So oddly enough, we found that, believe it or not, bifidobacterium actually works on the same immune pathways that COVID was attacking, which are the IL-6 pathways.
Okay.
It downregulates IL-6 and it upregulates a couple of anti-inflammatory pathways. So it was like it's getting rid of the immune pathway or at least it's downregulating.
It's like destroying the good bacteria, basically, kind of.
Well, so in adults, their levels start to decline. And oddly enough, children, we think that children have higher levels of this specific gut bacteria because, when you're born, it's like nature's way of building your immunity, right? Like, we have an innate immunity and we have adaptive immunity. And innate is what you're born with, right? But then as you grow, you develop even more of an immune system, and that's your adaptive immunity. So it's almost like kids have a higher level of this because it's their way of building up their adaptive immunity. And so that's what we found, that it's directly downregulating the immune pathways that COVID's affecting. So it was very interesting to see. And then we did a little bit more research on bifidobacterium in general, and it's actually been used like previously for numerous conditions with really good results. Including like influenza, kids with enterocolitis when they're born premature. Sometimes they have enterocolitis. So many other conditions, asthma, cancer. It's fascinating. Yeah. So it's in most probiotics, actually.
I was going to just ask that because I have to say, being a pharmacist, that's like the number one question we get. And they're always like, which one do you recommend? I've been recommending, because I'll take it myself, is Culturelle. But what one is the best one in your opinion? Because a lot of people want to know that.
Right. And Culturelle is good. And I mean, personally, I feel like there are so many that are good. But there are some that really aren't as high quality. So I do tell my patients to look for a few things. If you're going to buy the one that's not refrigerated, like the bottle, the pills, those usually require a little bit of a higher, like a colony count. They call it CFU, colony forming units. So you want to try, if you really want to kind of amp up your immune system, you want to try to get those higher than 50 billion CFUs. And that's something that you take a look at the bottle and read.
So higher than 50?
Higher than 50 billion for those, for the ones that aren't refrigerated, because
the non-refrigerated. Okay.
Yeah. You have to kind of like factor in the fact that they're not all going to survive. Right. And so the higher that count is, the better.
Cool to know.
Yeah.
Like all these things. Yeah.
I know. And you want to look at the CFU at the end of the shelf life, and it should be written on the bottle. So that's if you're doing the the regular probiotics that you get off the shelf. But there's other probiotics that you can get, which are refrigerated. And those are usually like a higher quality because they're refrigerated. They get shipped refrigerated to you. And so those are pretty good, but you also want to look at the CFUs as well.
Is that the Florister one?
Sorry?
Florister, I think it's called. I think that's, I feel like we had one in the fridge for a while, but it kind of like went passe. I don't know why, but there are a bunch. I mean, the one that's like all GI doctors and like doctors who have patients with inflammatory bowel, for example, they use the microbiome one, which was created by a GI specialist who really studied the gut. And that has like between 100 billion to 800 billion doses based on the formula. I don't think everybody needs that much. But that's like the gold standard one, and it's refrigerated. But then there's like another set of probiotics that are like the spore forming ones. So it's packets, like sachets. You open them and then you mix them in water, and that activates. That activates the bacteria, and then you swallow, and it's supposed to, like get to your out.
Well, not clean out, but like get to your intestines quicker, and but another thing like a lot of people don't realize is don't take a probiotic with food, because that slows the transit time, right? You want it to get to your lower intestines, right? So it slows the transit time. So the best time to take it is on an empty stomach.
Okay, like like before bed, maybe?
Before bed is good. I usually take it first thing in the morning. I'll just take that, and then I'll wait a little bit, and then I'll take the rest of my vitamins.
Yeah.
So yeah. But yeah, you want to make sure your stomach's been empty for a few hours beforehand.
That's good to know. See, look at all these that I can like pass on to patients,
Absolutely.
I could ask the experts, because I will say like that is like one of the number one questions we get. Like that's the most popular thing lately. So
interesting. Yeah. Are you feeling like gut health is like really exploding recently, and so much information, right, related to gut health? Yeah.
Yeah. It's like huge. It's like that. And then they want everybody to take the apple vinegar cider.
Yeah. Actually, that's a really good, I'm glad you brought that up, because I always feel like, yes, it's great to take a probiotic, but really work on taking a edible probiotic like apple cider vinegar, but also like kombucha, kefir, like try to incorporate fermented foods into your diet during the week, because those have like live cultures that are edible, right?
Right.
And even more importantly than that, you want to take prebiotics, right? So prebiotics are the fibers that are present in plant-based foods.
Okay.
Because those are actually think of them as like food for probiotics. Like my patients, like I try to explain it a little bit to them so that they understand, because a lot of the terms are confusing. Like, there's prebiotics, probiotics, and postbiotics, right? And like, what's the difference? So prebiotics are those plant-based fibers, right? That you're eating, vegetables, fruits, legumes. Those are the prebiotic fibers. And believe it or not, those are actually the food for your probiotics. So they're the food for your gut. And your gut bacteria feed on that. And then they feed on that, and they make a byproduct, right? And the byproduct is what you want. It's the postbiotics, right?
Okay.
Postbiotics are like short chain fatty acids. Like a common one is butyrate, for example. And these short chain fatty acids have been shown to actually improve the integrity of the gut lining and diminish inflammation. So that's why we do that, because, we want to increase our probiotics and, increase the good gut bacteria in our gut versus the bad. So those are all really like the most important things. And then a probiotic is good to supplement with additionally.
Right. Well, I gotta say, like, also like with the gut health, you bringing up inflammation. That's like another huge thing that everybody's talking about, gut inflammation. I've seen different diets now that are like, I think they're called the Galveston diet, like different diets to reduce inflammation, especially in, menopausal women. Like they have the hardest time keeping weight off, especially like even in your later 30s, you start noticing the weight gain. That's quick 10 that comes out of nowhere. And you're like, what happened?
Great, I know. I don't know. I just turned 50 and I feel like, wow, I really can't like lose weight like I used to. Like
I know.
Right?
I miss that. Any advice for women?
Yeah, I mean, and it's interesting that you said that, because our gut does affect our hormone levels. Like estrogen is it's like it's broken down, and the unbound form, like they call it the unconjugated form, is what like you want. And if you're not eating properly, then you're really like your estrogen levels are going to be out of whack. They're going to be either too low, and that can kind of predispose you to early menopause, but too high is not good either, right? Because estrogen turns into fat, right? So or fat turns into estrogen, sorry. So that's not good either. So definitely I always recommend what we call like an anti-inflammatory diet, which really means you want to focus on plant-based again, because that's what the studies show. Like the prebiotic fibers in plant-based really help our gut and diminish inflammation. And then you want to avoid as much as you can, like sugar, for example, because that has been shown to, like actually like sweeteners, artificial sweeteners are really bad for you. Because,
I agree. I tell people that all the time. And like, I can taste the kickback, and it's nasty. Like I can't drink a Diet Coke. I don't know how people...
I mean, I used to drink a lot of Diet Coke, and now that I don't drink it anymore, like I feel so much better. I mean, honestly, water is like underrated, right? Like just drink water.
I've been drinking a lot of that,
Yeah. But yeah, so like artificial sweeteners aren't good for your gut. And they've been shown to really affect inflammation as well.
Okay.
But yeah, so definitely like an inflammatory diet where you're eating a lot of plant-based fibers, limiting your refined carbs, your sugar. And it really does make a difference. It's not going to be overnight, but you know, like if you're doing that in a month's time, you will see a difference. But I also feel like everything's in moderation, right? And I think our bodies can tolerate like occasional insult. So if you have that, you know, cheat day every once in a while, it's fine too. We all have it.
Right.
But yeah, so.
I know, it's just like the getting older thing. I think a lot of people who listen, like around my age, we're in between the ages. So like, it's just like, wow, what just happened to me? You know?
Yeah.
And I feel like that, like, I feel like I've always felt like I've been like a bloated person anyway, but like, it sucks. That's the best way to put it.
I know I used to have really bad IBS, and like ever since I changed my diet, like this was years ago, like it's made such a huge difference. Like I'm also one of those people that like tends to get bloated too, but I've found like it really, really helps. Like water and changing your diet makes a huge difference. And then it shows up on your skin too.
Oh,
so,
that's good. Did you like stop eating meat and stuff?
I mean, I still incorporate like a little bit of animal protein. I'm sorry for all the vegans out there. Like I do believe though that, but I believe like everyone's so unique in what their body needs. And so for me, I feel like I do need a little bit of animal protein. I usually will focus more on like salmon, which is really good. It's got really high, you know, omega-3s, and more fish based. But
have you ever tried the Omaha steak salmon though? I have to tell you. Just random. That's how I work.
Okay. I mean, I've heard of their steaks. I've never tried their steaks either, but I've heard they're really good.
They're good. I'm kind of off of steak because it just wasn't working with. I have always loved it, but just some things I saw thanks to my vegan friends. Anyway, but their fish is really good, and they marinate it in this like sauce. It's just so good. You gotta try it.
I'll have to try it. Yeah.
Random plug. I don't even work.
Yeah. I get this wild salmon from Costco, which is I don't even know the name, but it's also like it has like this marinated like spice. Oh, you know, it's really, really good too.
Yeah.
So that's what I do. Yeah.
But like, so fish and that kind of like.
Yeah.
I have a hard time like with like lettuce and stuff though. It hurts my stomach. And I hate that.
Yeah. I mean, it's funny. Like I said, like we're all really different. And I mean, we can go into this maybe a little bit more, like, why do I maybe need a little bit more like animal protein versus someone else? You know, like we have like these neurotransmitters that are in our body, right? We have like 4 main ones, and believe it or not, like what you eat really helps to keep those levels stable. And there's 4. There's like acetylcholine, serotonin, dopamine, and what's the other one? GABA. Yeah.
Oh, yeah.
And each one has a job, right? So like most people know serotonin, right? Each one has a job, and each person actually is dominant in 1 or 2 neurotransmitters that kind of dictates your personality.
Okay.
So my dominance is acetylcholine. Like I've done that. Like I've done the questionnaire. Like it's part of my wellness exams that I do for my patients, but I'm an acetylcholine dominant individual. And so what that means is acetylcholine works on like the motivation part of your brain, but it also works on speed. So for me, like if I don't, and choline is made with fat, right? Like the choline portion of acetylcholine. Yeah. So I need a little more fat probably than someone else who might not. So when patients tell me like, well, you know, should I be a vegan? What should I do? I'm like, it honestly depends on what your body's needs are.
Right.
And so we kind of go through that to see, but it's fascinating, right? And like serotonin, for example, the precursor for serotonin is tryptophan. Like, well, where do you get tryptophan? Well, it's in foods, right? So if you eat a lot of foods,
turkey,
exactly. Everybody knows turkey, right? But like edamame is really high. Bananas are really high in tryptophan. Pineapples, walnuts, like most nuts are. So if you're someone who's serotonin deficient, for example, and like feeling down or getting a little bit anxious, then, you know, maybe focus on eating more of those foods as well. Yeah. So that's good to know. Yeah. So I mean, I think obviously like a lot of sugars and a lot of refined carbs are not good, but I think everything needs to be individualized because we are so different, right? Like everyone's so unique.
Right. So. Yeah. So this is something you do at your practice. You have people come in and they can fill out a survey and then kind of get to the bottom of the problems.
I mean, we focus on gut health, right? And I have patients who like do my weight loss program too. So like our goal is really to decrease inflammation, right? Because as you mentioned, like inflammation really does hinder your ability to lose weight adequately. So we look at what factors are causing you to maybe have a little bit of gut inflammation, but also then I will do the questionnaire where we check for your neurotransmitter dominance, but then we also check to see if you have any deficiencies. And then we can supplement with either like natural supplements that help to build those naturally or with foods. Like I'll give recommendations.
Cool.
Yeah. But then like with some patients, we do a gut analysis too, where we actually look at the gut microbiome. And the company that I use is like, I really like them because they'll not only tell you what organisms you have, but based on your DNA, they'll actually tell you, like, for example, you might be able to get away with like having a brownie every once in a while based on your findings. Whereas for me, it might not be so good for me. So so it's cool because they'll give patients that do it like a downloadable app. And then like every time you're eating something, you can put it in, and it'll tell you what like number you are based on your DNA. So I don't know, it's kind of cool.
That's a test you said?
Yeah, it's a gut test that I usually do as part of my wellness or weight loss evals. So
yeah, I feel like everything is connected to the gut, and I think more and more we're finding out about that. So you kind of picked the right like career right there.
Well, it's funny, like my background is internal medicine, right? So like I've been practicing internal medicine for 20 years. And as much as I love internal medicine, like my passion has always been like nutrition and how food affects like how we feel and how we look, right? And like as somebody who used to be obese when I was younger, like I saw a huge difference after I lost weight, like not only physically, but like it really affected me mentally too.
That's true.
So, right. Like, I mean, we all have our good days, right? When we're looking really good and eating right. Right. So that was something that I really like never felt like I had enough time to spend talking to my patients when I was doing like traditional internal medicine.
Right.
So that's why a couple of years ago, I just decided, you know what, I'm just going to do my own thing and like open my practice and just really focus on gut health, nutrition, and, teach patients and show them that really are like you really are what you eat. And you can dramatically affect how you feel and look just from your diet.
That's really cool to know. I feel like for me, I could use you because I always feel like, because, working and stuff, I'm like, especially when you work in 12-hour days, I don't have time. We don't get breaks. So I don't have time to eat, but I'm like, I need something quick and healthy, but I feel like I'm always missing out on something because of that. Or, you just get to the point where speaking of COVID, the vaccines came in when it was my long weekend to work, and I'm like 2:00, I'm starving. I'm like, and I don't even eat Wendy's. I was like, can someone just get me some food? And I'm having chicken nuggets,
Right. And that's usually what happens. Like I hear that a lot. I mean, we're all, we all have that where, if you don't have the food in front of you, then you end up like kind of just eating whatever, right? At 2:00 in the afternoon when you're so hungry.
You just get so hungry.
It is. I mean, it's horrible. I know. So what I do is I really like plan ahead. I will cook my meals like the night before, and I don't know, maybe I'm a little like OCD, but I'll actually plan out my like meals in the morning. Yeah. And I mean, I don't like stick to it, but I'll plan it out in my head. And then like sometimes I'll write it down because they've actually done studies where if you write down something, like you're more likely to stick to it.
Right.
So it's kind of like a to-do list, right?
Yeah.
But yeah, like I find that like the biggest, I guess the biggest hindrance in people like sticking to their diet plan is not planning ahead. But also like if you have, whatever, if like you cheat one day and you have whatever the cookie that happens to be at the office or whatever, like it's not a big deal to kind of just
not the end of the world.
Right. Like, just redirect. Right. But I feel like a lot of people are like, oh, I cheated. I'm just gonna, have like
I'm gonna starve myself today because
exactly.
That's not a good thing.
No. I mean, I'm a big proponent of fasting too, but like in short spurts, like intermittent fasting.
That's big. That's a big thing people are doing too.
Yeah, right. I would do a whole nother talk on that too. Like intermittent fasting is amazing. Like it does all these great things to your cells. It stimulates autophagy, which is like the renewal and regeneration of cells. So that's like a whole nother, I mean, whatever, we could talk
We'll
about.
have to have you come back on and talk about that sometime.
Yeah.
We'll have you all prepared for that talk.
I mean, I could talk a little bit about it too. It's basically, if you think about it, like if you're putting your phone in low battery mode when like you don't have enough battery, right? So what does your phone do? Like it focuses on only like really important things, right? So like trivial stuff, it like doesn't focus on. And basically the same thing happens when you're fasting is, when you're fasting, your body's like, okay, I'm not getting food. Let me get rid of like any old or dysfunctional cells so that I can focus on like the main stuff, the main functions. And that's what ends up happening. So like cells that may have been, prone to developing cancer or like other kind of dysfunctional cells, they get killed off, right? During fasting. Yeah, but that has to, like autophagy doesn't kick in for at least like 20 to 24 hours. So you have to do the fasting a little bit longer. But yeah, there's been like a bunch of studies. I think like a New England Journal of Medicine study came out a couple of years ago about the benefits of fasting for, like health overall, but like conditions like diabetes, inflammatory bowel disease. Like you're basically giving your bowels that time of rest, right? So like all these great, there's all these.
I would be hangry though.
Mm-hmm.
I'd get hangry.
It's like hangry. That happens early on when your body's not used to fasting, because like your body, believe it or not, is capable of sending fuel to its cells in other forms other than just like food, glucose, right? So when you're used to just like using glucose as the main source of fuel, then you get hangry, right? But if you it takes a few weeks, but then if you get used to fasting, what happens is your body's so smart that it knows it's not going to get food. And so the insulin levels drop, and then it actually ends up going to, like, I call it plan B and plan C. So plan B is like, it goes to the liver. Liver has like about 1,200 calories of stored glycogen that it actually converts into glucose for cells. So it'll go to that first. Yeah, it'll go to the liver. It'll burn off the glycogen and fuel the cells that way. But then, like when you run out of glycogen, it actually ends up going to the fat, right? Which is what we want. We want to lose weight. So it goes to the fat, and then it starts using like the ketones from burned fat as fuel. And believe it or not, ketones are like much better fuel sources for our cells than glucose is. So so that's what you want. Like, then that's how autophagy works, is you're kind of forcing your body to go to a better source of fuel. And when you're not used to it in the beginning, your body, like your body's resistant, right? Because it's like, I only know, like glucose, like feed me.
I only know food.
Yeah, exactly. So, and it's all like, it has to do with insulin and glucagon and like the hormones. You kind of just have to get your body used to another form of fuel. So,
I don't know if I could do it, but that is really cool to know about.
You could do it. It takes practice. Like I usually have my patients start off like with like 10 hours first of fasting.
Okay.
Where you're eating in a 10-hour period, and then you see how you feel for a few weeks, and then you kind of like slowly start to decrease the amount.
Yeah.
So,
well, you can do that like what, overnight, 10 hours? Yeah.
I mean, it's not that hard, right? Like if you think about it, if you eat like your last meal at like 7 or 8, right? And then you wake up, you just don't have anything until, whatever, 8. But like that's already there 12 hours. So
that actually doesn't sound too bad.
No, it's not. Yeah, it's not too bad. Training.
Yeah. Well, I mean, you are full of so much information. I love it. Everybody's going to love it. And it's been so good to talk to you. Congratulations on that article with COVID. Hopefully we're going away from that, right?
I think so. I mean, I don't know how it is where you are. Like in New York, it's gotten a lot better. Got some like restrictions eased up. So hopefully. I
know. I'm just crossing our fingers that same in Boston, but that we don't go kind of backwards, because I'm seeing a little bit too much, and I'm like, you're not all immunized yet. So what's happening?
I know exactly. I know. So we've been getting a lot of like vaccinations coming in, like more vaccinations than we had been. So I mean, I personally believe like gut health is like 10 times more important than a vaccine, but that's not something that happens overnight. Right. But yeah. And you have to think like, why are certain people like not getting sick at all?
Right.
Others getting really sick. Right.
I know. I have one friend, she was exposed twice. She's living with her brother and his fiance.
Yeah.
And they both got COVID. She never got it. She was exposed somewhere else at work, never got it. So I said, go get your blood tested, because she didn't know what she was. She is O. And I feel like more of these O people are the ones not getting it.
Right. I think A, right? A people are getting it more severely than O.
Is that what it is? I don't even know my blood type, but I think I had it prior to when it was called COVID last February. I'd never been so sick.
Huh.
Yeah.
You may have. Yeah, I know. Did you ever get your antibodies checked?
You know what? No, not yet. I have had the vaccine back in January, but what I noticed was interesting when it came out with COVID, and I always take Advil for pain, temperature, whatever. I could not get rid, and my body temperature is really low, 96.5 all the time. So when I hit 100, I was like, I'm in a bad spot right now. And I live by myself. So I'm like, this is not good. Couldn't get rid of the temperature. My dad, who always takes Tylenol, they stay here in the summer, had some left in his cabinet. And that was the only thing that I could take to break that temperature. So I'm pretty certain it was it, you know?
It may have. I think a lot of people had COVID and didn't even realize it.
Mm-hmm.
Especially so early. Yeah, I think I had it too. I think I had it back in March actually as well.
Yeah, it was like mid-February, early March, people were starting to get sick, but they weren't calling it what it was.
Right, exactly.
Yeah.
I know.
But I think it's interesting about somebody like her never getting it, ever.
Yeah, I mean, it like, bottom line, I think it's all like, it all has to do with like underlying inflammation, whether it's obvious inflammation or subclinical inflammation. And, you know, some people have that subclinical inflammation that you don't even realize until, you know, later on they might develop like some kind of, you know, chronic illness. But that's my MO. I'm sticking to it.
I like it. We'll have to have you come back on and talk about this some more, and diet and your weight loss stuff, because people are definitely interested in that. And so am I. So
would love to. Yeah, absolutely.
Yeah. Thanks for spending time with us. Where can everybody reach out to you?
I have an Instagram that I post a lot of information on, Dr. Christine B. It's the doctor spelled out. And I'm also on Clubhouse. I don't know if you have on Clubhouse.
I am, but it overwhelms me.
I just kind of just started, so I agree with you. But I kind of like that it's like, first of all, that it's voice, right? So you can kind of have all these great discussions, and I've listened to so many great discussions in other rooms. So I like that aspect of it, but I agree. Like I'm still kind of working out the kinks and trying to figure it out too.
Right. Yeah. There's a lot to it, but yeah, no, that's a great place for people to go and hear. So if you're on our Clubhouse, you can hear, you know, your point. Yeah.
And thank you so much for having me.
Of course. We'll have you back on soon, and stay safe out there. Or we'll talk soon. All right. This is Dr. Sara from Sessions with Sara on Helium Radio. We'll see you next week. Bye, Christine. Thank you so much.
Bye. Thanks for having me.
All righty.
Thank you for listening to Helium Radio. The views expressed by show hosts or their guests are their own and should not be construed in any way as advice from Helium Radio. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our website. Personal perspectives expressed by producers, writers, and editors will always be presented as such. Any rebroadcast or retransmission without the express written consent of Helium Radio is strictly prohibited. Thanks for listening.